The cheek and brow lift surgery is a method to reposition your eyebrows and maybe soften the wrinkles and creases around your eyes and around the forehead. Those are typically one of the early stages of visible aging to patients. Repositioning the anatomy sometimes will really smooth things out.
Well, I'm going to be 67 next month, and I was getting heavy-lidded, and I needed my eyes lifted a little for vision, if nothing else. But of course, he also did a cheek lift, and very pleased.
In Laura's case, what I did was the eyelids and her brow and cheek, and often we'll restore volume into the cheeks by injecting fat. And so I harvested some fat from her tummy, and we inject some of her own fat, so it's a nice natural result, and it just plumps up the cheek a little bit more, because as time goes by, the cheeks lose their volume.
Dr. Meade had suggested the brow lift instead of the eyelid lift, and he was very right, because I got the results that I really wanted.
It's almost like you're working on daylight savings time. You've backed the clock up, but it just sort of stays there. So will you continue aging? Of course. Would you need a touch-up? Sure. If you wait 10, 15 years, you'll still age 10 to 15 years, but you've backed up the clock that much.
The recovery was very easy, very little swelling, and the incisions were very hidden, and the swelling went down very quickly, and so did the bruising.
It's a real subtle but very nice clean improvement. It just makes you look refreshed. I love the surgery because after a couple of days the patients are smiling, they're glowing, they're just so happy. They're always very surprised at how easy the recovery was when I used the camera to do the cheek and brow lift.
Okay, after the procedure I feel so good and feel good about myself, and I'm a teacher. I am in front of the kids all the time, and it just gives you a lot of self-confidence.